Hi, it's Dr. Sam Benjamin. I've written a blog here on KTAR.com about what I believe is an impending crisis in healthcare that will affect your doctor's accessibility when you need him or her, most especially in primary care, family practice, pediatrics, internal medicine. If you have not read it yet, you should. The Affordable Health Care Act will add 30 million people to the healthcare rolls in 2014. We're already short tens of thousands of physicians across the country, especially in primary care. That number is escalating dramatically. It means that your wait for a primary care visit will get longer and longer, and you will more than likely not be seeing a physician but a nurse practitioner if there are any available, because they too are in very short supply. Now, here are my suggestions of what you must do soon so that you minimize the adverse effects which you are already noticing if you have made an appointment to see your family doctor or general internist recently. 1, be sure to establish a relationship with a primary care provider now, whether you think you need it or not. Don't wait. Many doctors' panels will be closed as they're overrun with new patients. They're not going to accept you. Number 2, make your annual appointment months in advance and start on this now. Don't wait. Women may need annual physical exams, and men, well, come on, man, don't wait until you're sick. Men tend to avoid preventive visits. Do not make that mistake anymore, guys. You will not have the luxury of suddenly noticing something and thinking that you'll see a doctor in a few days or weeks. Try months and months for a wait. You don't want to do that. You want to start doing things in an anticipatory fashion. Number 3, think every year from now on that what your insurance will cover is going to decrease and that your costs are going to climb with each new annual renewal of your insurance. And this should be a given whether you're an employee of a company or self-employed and buy your insurance individually. Costs are going to increase. In fact, they may skyrocket, and this will probably occur even if the Affordable Health Care Act were to be repealed, and much of it is never going to be repealed. Let me assure you, that's like a pipe dream. Even if Romney is elected, it will just be given a different name. For example, if you think that insurance companies will be allowed to reverse coverage of your kids through age 26, you're dreaming. Parents will rebel. If you think that insurance companies will be allowed to reject your application for coverage because you have a pre-existing condition, which the Affordable Health Care Act has now changed, and you think they're going to do it like they used to, dream on. It ain't happening. It is not going to be reversed, but someone, and that's you, will have to pay for this. So get ready to put aside more of the little dollars that you earn and putting them aside for health care. Getting free care will become much harder. So you may feel fine right now, but you need to put some cash aside. I warn you. Also, get whatever you need done, like tests, this insurance year. You know what it will cost now and that it's covered. You have no idea down the road. So don't delay the MR scan or the blood test that your doctor has recommended. 4, and I really mean this, listen to my show. Check out the health information that you can get on KTAR.com and on drb.tv and on my Facebook fan page. You're going to have to become much more proactive in your health. This is an issue because Americans, unless they're sick, do not see health care as a priority. You will not be able to count on your doctor's office as your key source of information about your health and the health of your family. You need to know about natural therapies because they're often cheaper and do not require a prescription. And since you won't be getting into a doctor's office, you may need to get something fast. This is important because you will find it harder and harder and harder to get that prescription from your doctor. You will need to learn about traveling elsewhere to get care. You will need to learn about medical tourism. You will need to learn about what to do when the government and insurance companies turn your care needs down. And this is going to happen because there are millions more insureds and less money. You will need to learn about where to access a doctor, what is the easiest place to get a doctor, and you may have to travel a darn good distance to get the care that you need. I can go on, but I hope that you get the point. Listen up. This is Dr. Sam Benjamin with medical news that you can use.